Thank you for the invitation. I'm going to be quite brief on what is a topic that deserves a lot more than brevity, but in order to give some context for the discussion and other contributions today, I'll do what I can in 15 minutes. Really, I've got three aspects that I will try and cover. Firstly, a brief, very brief delineation of the global nursing workforce, then look at a bit more detail at how the pandemic has impacted on nurses and on health systems. And finally, look more forward, look at what are some of the possible policies and interventions that can, in different countries, hopefully move us to a better future for population and a better future for nurses. Much of what I'm driving today comes from a report that I co-authored, which was published earlier this year, called Sustain and Retain in 2022 and Beyond, published by the International Council of Nurses. It's available free online. I can give you a link at the end of my presentation. So I'm just going to start with a couple of slides to briefly describe the global nursing workforce. What I'm doing here in the next couple of slides is summarizing key points from a report published by the World Health Organization called The State of the World's Nursing. It was published in early 2020, and as such, it is describing the pre-pandemic profile of the global nursing workforce, but that does give us a very useful benchmark to then begin to track changes and trends since the impact of the pandemic. So at that time, 2020, the report estimated a global workforce of nurses of about 28 million, 27.9 million. A shortage estimate of around about 5.9 million, and perhaps not surprisingly, a clear message that most of those shortages were concentrated in low and lower middle income countries. About 1 in 6 of the world's nurses was expected to retire over the next 10 years. So in essence, that means just to replace those who are going to retire would require 4.7 million more nurses coming into the workforce. High income countries, on average, had more than 3 times the nurse graduation rate. That's nurses per 100,000 population. As did lower income countries. Again, perhaps not surprising, high income countries have more resources, more possibilities of investing in educating more nurses, but that does really set the scene for the big variations across countries in terms of the new supply coming into the the nursing workforce. And you've already mentioned migration and mobility. About 1 in every 8 nurses was practicing in a country other than the one in which they were born or trained. So a very significant number. It varies a lot country by country, but essentially, if you have a registered nurse qualification, you can often have many opportunities to move if you wish. So those are just a few key points from the pre-pandemic profile. Then the pandemic hit early 2020 and onwards. And what we have seen is particularly a lot of concern about the impact on nurses' health and well-being, particularly looking at burnout. And one of the concerns there is that the research on nurse burnout clearly links it to poor quality of care, lower patient satisfaction, and reduced productivity. So the concern about burnout is a concern for the nurses, but it's also got to be a concern and recognition that burnout is not good for health systems. It's going to undermine quality of care, productivity. So the pandemic has tended to magnify any pre-existing causes of burnout. What we have been seeing are burnt out nurses being absent or leaving work or stepping down, trying to reduce the hours they work, or looking at early retirement. So those are all putting pressure on the nurses who remain, because they then have increasing levels of stress also. Also, there have been a lot of surveys of nurses in different countries, many of them reporting very high percentages of nurses reporting intention to leave, considering leaving the profession or leaving their work. And this is a big concern, because if the intention to leave becomes nurses who have left, we have a very big problem. Also, a lot of the evidence coming through, there's much emphasis on individual nurses being resilient, but what we need is a recognition that employers and systems have a duty of care to those nurses. So we need less emphasis on individual nurse resilience and much more on system support for nurses who are in very challenging circumstances. Finally, we have an unknown. We have long COVID, which as yet is not fully impacting, but is, we anticipate, going to increase demand further. So I did mention that I would try and focus, once describing the major factors which are impacting on the workforce, COVID and post-COVID, is focus more on what are some of the solutions, potential solutions. And what I've done here is synthesize the key messages from Sustain and Retain, looking at what are the evidence-based policy interventions which have been demonstrated to improve retention of nurses. And what I've done is put them in two columns here. There are a grouping of retention factors pre-existing the pandemic. So they have more evidence-based support for their consideration. And if you read through them, I won't go through them in detail, but they are somewhat predictable. Most people, most nurses, if they had a discussion about what can improve retention, these are the types of interventions they would be coming up with. So it's about work environment, working relationships, pay and other incentives, flexible hours, career opportunities, access to career development and education, manageable workload, safe staffing, and so on. And therefore, there's a group of potential interventions that need to be given consideration, which are almost generic. Any health system anywhere needs to be confident that these different interventions have been given consideration. Then on the right-hand column, we have the new retention factors which have come about because of the pandemic. Many countries, nurses still do not have access to full vaccines and don't have access always to effective PPE. So those are pandemic-driven factors. They're particularly prominent still in some low-income countries and do need to be addressed. We've then got another 3 bullet points there. Provision of appropriate training during redeployment. Many nurses had to shift to different care environments to be part of surge responses. This was not always well supported by appropriate training. So there's a need to look at better provision of training during redeployment. And then there are 2 final issues there. Support for respite or time away from heavy pressure areas of work, and also looking at support for health and well-being. So there's in total maybe 10 or 12 interventions that need to be given full consideration. I'm going to conclude now. I just have one final slide here. Looking at the national focus to achieve a better future, and also the international focus. Left-hand column, what do countries and governments need to be giving consideration to if they're going to move to a better place in terms of nursing workforce, and therefore move to a better place in terms of the improvements in population health. So we need safe staffing levels in all systems, and we're not there, we're not nearly there in many. We have vacancies, we have shortages that need to be addressed. Secondly, the point I made in the previous slide, all nurses need to be fully vaccinated for full protection. There's also a need in health systems to assess what the impact of the pandemic has been, what absenteeism levels have changed, what's the level of burnout, what's the level of intention to leave. That has to be accurate and appropriate to the care environment where policies are being given consideration. There's also in many countries a need to look at domestic nurse education. Are we training enough to move towards self-sufficiency? And part of self-sufficiency is also looking at retention. The retention factors I gave more detail on in the previous slide. We've also got to look at how we can optimize the contribution of nurses. And that in many countries is looking at much more use of nurses in advanced roles, nurse practitioners, and so on. And finally, we need to be able to, at national level, assess the extent to which countries are self-sufficient or moving towards self-sufficiency in terms of nursing workforce. Those are primarily the responsibilities of each country and the government in each country. There's then on the right-hand column, what I've summarized as international areas of intervention or coordinated support. The first is, I mentioned at the beginning, the state of the world's nursing was very helpful in mapping out what the workforce looked like, but that was pre-COVID. There's a real need to replicate that study, but update it to take account of what's happened to the workforce in terms of impact because of COVID. High-income countries need to work together with international donors to make commitments to ensure there's full vaccinations for all nurses in low-income countries. That's my next point. Third point, picking up on the migration and mobility issue. All countries who are involved in active international recruitment, and that is many countries and a growing number of countries, need to commit to an ethical approach which is underpinned and framed by the WHO Code of Conduct on International Recruitment of Health Personnel. So any of you who are listening to this who have concerns about what's going on in your own country in relation to an ethical approach, check on the WHO website and look at the global code and use that and ensure that your policymakers and nurse leaders are aware of it. Final 2 points, support for nurse workforce impact assessments in low-income countries, and also looking at other types of investment in low-income countries in terms of those that are particularly vulnerable to nurse outflow, that point about outflow and the damage that can occur to countries that have low resources of nurses anyway. So that's just really my final slide. Hopefully there's quite a lot of food for thought for possible discussion. And for those of you who are interested in the sources of the material I presented, in particular the first one there, that's the Sustain and Retain report, which we published earlier this year. And we are looking to update and publish a new report next year in a similar structure. Thanks very much for your attention. I'll stop sharing now and hand back to Buchan. Thank you.
Thank you so much, Professor Buchan, for your incredible talk, covering a wide range of the issue of the nursing patient. And thank you for your time. I know it's almost midnight there. I see a question in the chat box. If it's okay for you, I can ask this. And from the Aaron, how many have signed up the global ethical codes? Is it governmental level of to sign up?
All member states of WHO have signed up to the code. So that's virtually every country in the world. And it's the federal or central government that's signed. Signed is not quite right. They've approved the code. It's voluntary, but it's there and they've all endorsed it. So it's very useful in terms of engaging with policymakers and country governments to ensure that they follow the guidelines that are set out in the code.
I will have the last question from Anne. And she says, we know that some HICs do not comply with the ethical codes and continue on. What we can do?
What I think you have to do in those circumstances is use the code as a frame, ensure that the monitoring of the application of the code, which every country reports into WHO, takes account of any potential malpractice. And it's often the case that this happens because there are a multiplicity of employers in countries, not just public sector, not just governments. And it's important to ensure that the monitoring and compliance is followed by all employers in a country, not just large employers or the government. So it really is up to individuals, to nursing associations to contribute to monitoring and highlight if there appear to be breaches of the code and ensure those are reported in.
Thank you so much for your time, and thank you for being us today.
Thank you.